Okay. Good evening, everyone. I'm really delighted to be hosting this webinar tonight, introducing our families to our Prader-Willi syndrome nurse coordinators at Sydney Children's Hospital and at Queensland Children's Hospital. I'm Kathlene Jones and I'm the founder and CEO of the Prader-Willi Research Foundation Australia. I'm also mum to Chloe, and she was a catalyst for our work and for the establishment of the Prader-Willi Research Foundation Australia. This is her beautiful smile lighting up your screens this evening. And while she was the catalyst for Prader-Willi Research Foundation Australia, it is you, our incredible supporters and families, who've enabled our work to really grow and thrive. The landscape for people with Prader-Willi syndrome living in Australia is transforming in front of our eyes. When I founded this organisation, a treatment for hyperphagia and a gene-activating treatment were just pipe dreams, and now they're becoming reality for a generation of people living with Prader-Willi syndrome. It's actually quite breathtaking watching our hope become reality. Before we jump into tonight's webinar, I'd like to acknowledge the traditional custodians of the lands on which we're meeting. I'm joining you from the lands of the Turrbal and Jagera people who've been custodians of this land from time immemorial. I pay my respect to elders past, present and emerging, and we look forward to the day where there is healthcare equality. I'd like to remind you that tonight is a live Q&A session. So if you have any questions, just put them here. You can see now I'm pointing at the Q&A. Just pop them in there and we'll have a question session following our panel introductions. And just, of course, today's Giving Day. For us, I need to give it a quick plug. This campaign is critical to enabling our work. When we receive grants, most of that money goes to researchers and projects, and it's this campaign that actually enables us to make grants to fund projects like our wonderful Prader-Willi nurse coordinators and to keep our lights on. We've had an incredibly generous donor this year who is matching donations up to $125,000. When I last checked, we were at $140,000, which is just incredible. And I have to say thank you to everybody who has enabled that and supported our Giving Day today. We do still have another $50,000 roughly available for matching. So if you are able to share our campaign at all, that would be a huge benefit to continuing our work. Also, a disclaimer, tonight's webinar is not providing specific medical advice. We're holding general conversations about the needs and the care available for our loved ones with Prader-Willi syndrome and how our families might be able to access specific advice that you need. Just a reminder again, it is not providing specific medical advice for you. Now, a little bit about the Centre of Expertise. The idea for the PWS Centre of Expertise and the Prader-Willi nurse coordinators started with a series of surveys and interviews and a national workshop that was conducted by the Prader-Willi Research Foundation Australia. The objective was to understand more fully the needs of our children and adults living with PWS and where we needed to focus our efforts and work. We discovered the need for a change in healthcare delivery. The need for care was to be preventative, not reactive, to be informed with a deep understanding of Prader-Willi syndrome, which is so very complex and atypical, needed to be accessible by GPs and non-Prader-Willi clinicians and emergency departments all across the country. And it needed to be really patient-centric, accounting for the anxiety, the fragile mental health and the behaviours of people with Prader-Willi syndrome. Families needed help to navigate the healthcare system, especially where our kiddos can have 10 or more clinicians and allied health carers. And most of all, healthcare needed to be nationally delivered rather than by states. We have enough people living with Prader-Willi syndrome across Australia that doctors can care for enough patients to become really deep experts in Prader-Willi syndrome. And this is where we need to break down barriers of geography. The PWS Centre of Expertise has started with a few elements. Firstly, the clinical advisory group, which helps us to focus our work. In particular, they've worked on how the nurses should be organised to support families, and they've also identified the need for national clinical care guidelines. Every 2 months, we have the Clinical Care Network, which is a 2-monthly professional development sessions on Prader-Willi syndrome for doctors from across the country. And Dr. Häusler, who hosts those, can tell you more about them. The PWS nurse coordinators are focusing on newly diagnosed newborn and in-crisis patients. Also, families can contact them directly, as can GPs and specialists who need to tap into deep Prader-Willi expertise. The nurses are also working on establishing family resources, creating awareness across their states about PWS and accessing and how to access their support, linking doctors together and linking us in with rare care hubs. And most critically, this is a pilot program. We're measuring activity and gathering patient feedback so that we can apply for funding to expand and make this service sustainable. It's really exciting. So without any more from me, I'm going to introduce our panel, and then we'll start a panel conversation. So we have Anne Hind, who's the Prader-Willi Syndrome Nurse Coordinator at Queensland Children's Hospital. We have Associate Professor Honey Häusler, who's a Medical Director of Child and Youth Community Health Services at Queensland Children's Hospital. Charlotte Island Larratt, who's a PWS Nurse Coordinator from Sydney Children's Hospital, and Dr. Owen Yount, who's the Paediatric Endocrinologist from Sydney Children's Hospital. I want to welcome you all and thank you so much for all of the wonderful work that you do. We might go around the room with introductions, and I'm just going to start from the left-hand side of my screen. And if you can tell us about, your role, your background with Prader-Willi syndrome, and what your vision is for this work that we're doing. Owen, would you like to start?
Sure. My name is Owen Yount. I'm a pediatric endocrinologist at Sydney Children's Hospital at Randwick, as well as Royal North Shore Hospital in Sydney. I have a clinical interest and research interest in Prader-Willi syndrome, and I did my PhD studies at the University of Queensland on Prader-Willi syndrome. So my thesis was on the energy homeostasis in children with Prader-Willi syndrome. My vision for the Centre of Expertise is to assist the families who were recently diagnosed, and then to navigate, help them navigate through the medical system, and also to assist them at the time of crisis, and also facilitate in transition to adult care. So we have been operational for a number of months, and at our center at Sydney Children's Hospital. So you will hear more about what we have done so far from Charlotte. Thank you.
Thank you, Owen. And that's a great segue. Charlotte, would you like to tell us about your background and your role now, and what your vision and what's exciting to you about your role?
Yeah, absolutely. Hi, everyone. My name's Charlotte. I work at Sydney Children's Hospital, obviously 1 day a week in the PWS Nurse Navigator role, and the remaining 4 days of my week, I'm under the Neurology Department coordinating clinical trials. So a little bit about my background. I actually started out in psychology back in South Australia. I did my thesis at the Women's and Children's Hospital looking at behavioural and neurodevelopmental impacts of sleep disturbance in kids, and worked as a youth worker in a local primary school. So looking back, I think that's where my love of working with kids really began. when I moved to Sydney, I studied nursing and very quickly moved into paediatrics, and worked in a few different areas: renal, cardiac, infant surgical, and neurology, and had some interaction with some kids with Prader-Willi syndrome, but had a lot to learn once I started in the role. So this sort of eventually I led into research in my current role. And then when the PWS Nurse Navigator role came up, it felt sort of like a bit of a serendipitous mix of a lot of the things I care about in my job. So working closely with families to support and advocate, and working with kids with unique needs who could really benefit from someone helping to connect the dots in their care. I started the role back in March, so it's been about 8 months now, and it's been a really rewarding start. I feel that more than just coordination, the role has been about connection and about advocacy. So helping families feel like they have someone walking alongside them to navigate the health system. So my vision and sort of focus, I suppose, for the role is that when a baby or a child is diagnosed with PWS, families are immediately connected to the right information, the right clinicians, and the right support. So they feel like they've got a partner moving forward rather than finding their way alone. As Kathlene mentioned, we're really keen to develop some resources to support this. So that's an exciting goal to have for the future of the role. I suppose more than anything, I feel really privileged that I get to work with really incredible and dedicated health professionals, but most importantly, the families who are such strong advocates for their kids. So it's a huge privilege to play even a small role in supporting families living with PWS.
Thank you, Charlotte. I should share some feedback from one of the families who emailed me and said that Charlotte was the connective glue that brought together the many doctors, nurses and healthcare practitioners that were required. This was incredibly helpful when we were processing the diagnosis, learning about the best early interventions and advocating on behalf of our baby. It's just wonderful feedback, Charlotte, and this is exactly why we've been funding these roles. We had previously done work on mapping out the diagnostic journey, and it was a very different story. It was a story of families feeling lost and unsupported. So thank you very much. It's wonderful to see.
Thank you.
Now, Dr. Honey Heusler, you're on mute. Would you be able to talk a little bit about your role and your vision?
So I'm a developmental and sleep paediatrician based here in Brisbane. I have worked off and on with Prader-Willi syndrome for a very long time. But Kathlene came to me a little while ago just looking for some support to try and set up the system. I'm not currently in the clinic. I'm sort of trying to build succession planning and succession expertise as we go. So it's been really exciting to see, because in fact the Prader-Willi Research Foundation had done a lot of work highlighting the journey and the areas where families wanted to target their resources in terms of the next step forward. I think it's been a little bit of a slow burn in terms of getting there, but remembering all of us are sort of trying to do things on a wing and a prayer a little bit. But I think we're moving in the right direction. And one of the most exciting things, I think, is the number of clinical trials that are just coming over the horizon. We had our first aardvark patient this week. We have trials coming out our ears. There's probably going to be at least 4 coming on board, in first quarter next year. So I think the horizon is bright for improving the lives of individuals with Prader-Willi syndrome, particularly in the areas that have been highlighted by families, the hyperphagia, the those sorts of things, sleep, there's a whole bunch of things there that if we can modify those things may well really revolutionise the lives for these families. I had a big role in the clinical network, and it seems to be going very well. I couldn't get to the last one because of illness and a few other things, but we've had some very successful meetings and some wonderful presentations from people who know a lot about Prader-Willi syndrome. So it's been a really beneficial thing. So I'm hoping the nurses can make it to that as well. Having the nurses in supporting conditions that are rare is absolutely changes the lives of families, and just quietly changes the lives of doctors too, because they're absolutely that connection, as you said, Charlotte, between families and the system. And the system is complicated. I hate the fact we've built a health system that requires people to support families to navigate it. To me, that is kind of, all round the wrong way. It should be simple enough, but it's not. And so I think the value of having nurses to support the families in, all of the sort of pragmatic and practical and psychological and psychosocial things that happen in that sort of phase of early diagnosis, and then get them to where they need to be. And in some respects, contain some of the stressors that happen at that time, because you can't sort it all at once. And that is about walking alongside families as they go through this process. So I am really excited Annie's starting, so that we can build that. We've known Annie for a very long time because she's been doing a similar role in another syndrome, which I'll let her go talk to you about as well. So she's got a lot of experience in working in this sort of rare disorders, supporting families through this process. My vision is having this virtual network that can then sort of function in a sort of semi-autonomous way where people can come together, solve problems collaboratively, that we have a network that can flag and support and advocate and do all of those things in a lifespan service, which would just be amazing. I think our health systems have got a long way to go before we get to a long lifespan service, but that would be my dream vision to get to that point. I think we've got a few things on the horizon. One is the bringing together of a number of people to write some guidelines for the Australian context. There are lots of guidelines around, and it's really going to be essentially a review of that, identify the gaps and put them into the Australian context, which is probably our next big piece of work, I think. So, yeah, work in progress, but delighted to have you both on board. And from the network's perspective, this is the beginning of bigger things. I think, I love that saying, from small things, big things grow. And it applies to, pediatrics and all sorts of things. But the nubbin of this, I think, is going to be central to the network of having a nurse navigator, nurse connector across the country. But we have to start in a small way and demonstrate the impact, because the health system only responds to evidence, and evidence that you save money. And so that is a key part of what we're trying to do here, is looking at the impact, both for families, but how, something that's small but has a big impact can improve the lives and outcomes for people and families. So that is kind of where we're hoping to head in the longer term. We'd love one of you in every state, and we will get there, but it's just going to be a gradual process.
Thank you so much, honey. Inspirational as always. Thank you. And would you like to welcome on board? And would you like to introduce yourself, talk a little bit about your background, and then what is exciting you about this role?
Well, I've done my first day last week in the Prader-Willi syndrome-like position. My background is I was a late nurse. I came into nursing in my 30s. I've worked in oncology, neurology, orthopedics, all in pediatrics. So I've only ever had a pediatric career. And I did quite some time in ED for 5 years before I went out to child health, out in the community where I looked after children from 0 to 4. I then came back to ED and then got the position of 22Q coordinator, which is looking after, we have 230 children in Queensland and New South Wales, and we have specialised clinic that we run fortnightly. I run that with Dr. Vanita Prasad. And I've been running and working with Vanita for the last 3.5 years. In regards to the Prader-Willi position, I felt that it was very natural for me to cross over to this position, especially after working with our 22Q children. It's very varied, our children, in regards to a lot of medical, developmental, basically we have surveillance on these children from when they're born. And it's building that relationship with the families that is very important to me. So, for example, now that we've got the new diagnosis coming through, I will go and I'll meet that family, whether at the MARTA or in a hospital. I meet them, I introduce myself, and we have a rapport. They know that they're looked after by the 22Q clinic. They're able to come to me for any queries that they have, especially with our young cohort. They're usually going through cardiac surgery or other surgeries. So it's very important that I am in the parent's life and the family's life as well. I'm very compassionate about looking after our families, especially with children, and supporting the parents. I think our parents go through a lot, and it's all about supporting them as well as our children. And I found through the 22Q clinic, building those relationships that I have, those parents can come to me at any time. They can ring me up, Annie, I've got this issue, Annie, I've got this problem. I get lots of emails. I'm always like supporting them. But also, like, from a clinic perspective, I've gone and had a very, like, as I said, I've only done 1 day so far, but I actually went and had a look at the clinic and how it runs. I can see, you know, we have a very multidisciplinary team that's working with our children. With myself, I only work with Vanita. And so that is quite different, going from myself and Vanita managing everything to then this whole clinic of numerous specialists. So I got to sit in on Kate's conference and really kind of see the banter and everything that we discussed before our children come through. I think my vision definitely is to get some good guidelines in place, especially for parents and our little ones that come through, that we have a bit of a navigation through the system, as in for 22Q, we have a surveillance. We're looking for different aspects at different times of their lives, from a baby right through to we let them go at 18. We are surveillance. We're doing a lot of surveillance on these children, where we're looking at, for example, a psychosis at around those teenage years. the anxiety and depression that will go through, the younger years, as well as all the developmental aspects as well. So it's really working with those parents, making sure. One big thing that I'm very, very big on with 22Q Clinic is that our parents attend. Very, very passionate about that, because a lot of our parents may not be able to attend if they're regional, or, for example, if they don't have enough money to come to the appointment. It's all about making sure that we support our parents to come to these appointments, and then doing that follow-up afterwards, which, for example, in the 22Q Clinic, I will follow up what the plan is from the specialist, which will be, in my case now, with endocrine, respiratory, dietitian, etc., making sure that those plans are followed through, and that the parents are kind of a little bit, handheld through that process, and that we do, for example, have blood tests done, assessments done with school, etc. So I guess for me, it's working with the parents, it's supporting the parents, and giving them as much, I guess, just making sure that they feel supported, because it is very big. There's a lot of specialists everywhere. Everything is very fragmented at times, especially in the health system. We have different, for our oral health is different to this, particular way that different departments run. It's about bringing it all together. It's making those connections in those departments, and making sure that our children have a nice, seamless, support through their life journey, and the parents as well. Also, providing, as I said, those guidelines. I talked to Charlotte through the week. As I said to Charlotte, we're, kind of those guidelines for Australia, how we can best support parents, packs and things like that, that they're able to feel very confident on their journey with their child, and knowing that they have the support from someone that they can ring up and come to when they're feeling at that crisis mode, that we can we can most certainly support them as much as we can.
Thank you so much, Anne. It was really interesting to hear you talking about that sense of overwhelm, particularly in the beginning when you first get a diagnosis. Personally, I remember getting it and never heard of this condition before, and suddenly there's a future that you've got to wrap your head around, and at the same time, while you're dealing with that, you also have to get on top of the healthcare system and all of the different disciplines around this whole medical condition, and how do I manage this from now on? I just wonder if, Charlotte, you could talk a little bit about how you've seen that play out with families, and then the role that you've taken in supporting families to really sort of wrap their head around, their baby's diagnosis or their young child's diagnosis, and where to go from here.
Yeah, absolutely. Since starting in March, we have actually seen 4 new diagnosis PWS infants, which has felt like quite a big run. There's a few ways that we're focusing on supporting. So I feel like with every family, I've felt really privileged that I've learnt so much from them. I remember speaking to the very first new diagnosis family that I had and saying, I'm so grateful for how much I've learnt from you guys. So what I've sort of tried to focus on, as Annie kind of alluded to, we're hoping to one day start or create a sort of new diagnosis pack. In the meantime, without having that, I've sort of been doing a bit of an ad hoc system. So I sort of bring together whatever resources I can, secondary to meeting the families. So I've had some really wonderful connections made already with our genetics team, obviously with our endocrinologists and sleep, but our genetics team, both at Westmead and Randwick, have jumped on board this service and have been able to refer to me as early as possible. So in meeting the family, I've just sort of gauged where they're at, and do my best to provide care that is specific to the family, so as sort of family-centred as possible. So I've already, in this short time and in these very few families, seen a really great diversity in response, in how many sort of questions and where those questions sit, and therefore what I'm providing and what information I'm giving and what support I'm giving is different to an extent every single time. But as I said, so I'll sort of base off of that what kind of resources I'll be providing. So I've just been creating packs with a folder and providing that to families, and then regularly checking in throughout their either NICU or hospital experience, and taking that time to build rapport, because so much of the information that is being blasted at families, it's not going in, and I think that's a pretty common experience across all of healthcare. But as I sort of mentioned earlier as well, just ensuring that we're linking with all of the right clinicians. So I've also felt so fortunate within our hospital that everyone has done this so well. I've seen NICU send all the appropriate referrals to our endocrine, to our developmental team, to allied health. But wherever there has been a small gap identified, or maybe a lack of awareness of our Tumberton developmental clinic that kids might come to when they're a little bit older, I've been able to kind of ensure those connections and inform the clinicians about what else is out there and ensure that families aren't missing any specialty. That's probably the biggest question that I'm getting early on as well, is what can we do? What should we be doing right now? And who is everyone we need to be seeing? So that's why I find that having that physical pack and having some paper information, where it can almost be somewhat of a tick box of who is this clinician and what specialty are they from, and have I got everything covered? I think that will only improve, as I said, as we develop our own resources. But in the meantime, I'm very happy to hear from the feedback that you gave earlier from a family that it has been working so far. As I've sort of mentioned as well, new diagnosis being our main focus, these are the families that I'm proactively following up with the most. So perhaps an older family who are asking, an odd question or an odd phone call, I'll wait until I hear from them again if there's any need that arises. But with our new diagnoses, I really regularly check in and ensure that they're not feeling left behind or forgotten, or that there are any gaps, and hopefully answering what questions I can.
So Charlotte, that's amazing. You're actually reaching out to those families proactively once they've been discharged. Thank you for doing that. That's really great. Yeah, I know that would have made a huge difference to us. There was another piece of feedback that I did want to share. That was particularly about how you worked with families, Charlotte, and it was getting access to growth hormone is one of the most effective, proven early interventions, and we really wanted to prioritise this for our baby. When some of the paperwork appeared to be taking several weeks, Charlotte was able to help step in and eliminate our wait time with a helpful email. This was a big relief to us. So, and I could imagine, growth hormone is such a high priority for families. And I do happen to know that this family was going to be waiting quite a while to get access to that, to all of the sleep studies, etc. So it does make a huge difference. Otherwise people are left, asking questions on, or not having anyone to reach out to, or asking questions on social media, which is great, but there's only so much, you're able to actually change things, which is wonderful.
Thank you. That's lovely.
I wanted to, we have a couple of questions. We have a question from some of our participants, which I will go to in a second. We did have another question about how can families contact Anne and Charlotte.
So we have I have my specific PWS Sydney Children's email address that I've been sharing far and wide. So I've done my best to sort of just spread my name. I've made a few connections with various New South Wales hospitals, genetics, endocrinologists, sleep specialists across the board, providing that email address. And whenever I meet families, I provide my email address. So I'm happy to share that in the chat, or Kathlene, if you'd love to, I'd love you to share it on the website. And yeah, always happy to be contacted.
Wonderful.
I think, Charlotte, that's great that you've actually got that email. I've actually spoken to my team leader, Michael, and said, look, for 22Q, I have my own email address. So everyone contacts me, all goes through the 22Q email. And I said, look, do I have my own email address here? Or so at the moment, it's going to go through the where I work under, which is the Witch Honey is under Michael's team. At the moment, I'm going to use that address, but perhaps we can look at myself having my own.
And we could set up a specific address.
Yeah, similar to Charlotte's. So
yeah.
that's, Queensland, New South Wales, it's similar lines. So
yeah. Right. So we'll set up that email as soon as we can, I think, and then share it with you, Kathlene, for dissemination as much as we can.
That would be great. We'll get a page set up on our own website that features Charlotte and Anne and lets people contact them.
Yeah.
We do have a question. We've had one question about will there be a nurse in Melbourne, another question about Perth. So I think that this is a bit of a multi-pronged question, actually, because this is about geography, but I also think it's about lifespan. So we can actually, I'm happy to talk to sort of some of that myself, but if you wanted to start, Honey, to kick off with, and I spoke a little bit about.
The question about the connection with Perth, I'm not specifically sure of the actual setup unless Owen has a better idea, but we certainly have clinicians from Perth in our clinician network. So we can find out from them the best way to connect you, Naomi. If you, I don't know the best way of contacting, maybe if you put your email in the chat, we can let you know how best to contact someone there, but it'll need a little bit of research for us to actually find out their best contact. So connecting, I think, is the thing. Excellent.
Yeah,
and
I think through our professional organizations, we have a very close contact with the our colleagues from Perth, and we can easily liaise with them to develop a centre in Perth and also in Melbourne.
Naomi, can you just let us know how old your child is? And we can sort that. Excellent. Great. Someone will be in touch, Naomi.
Thank you. And I think that Tina, we actually have we have begun conversations with Royal Children's Hospital about putting a nurse in there, and we have reached an agreement in terms of we'd like to proceed, and we've sent them a funding agreement. So it's now in the hands of the legal team, and I think that we need to be really mindful that it can take quite a long time for legal teams in hospitals to process this documentation. So it is underway. I think the other thing is that where do we go in terms of adults, because we would very much like to make, as Honey was saying earlier, a lifespan service, whole of life. That was part of our initial vision, and definitely the feedback we had from families is that it's very difficult to transition children into adult services, and that in many ways the knowledge of Prader-Willi is more important than adult and children. And we've spoken to, I know that in some countries that they really do just continue it as a lifespan service because that Prader-Willi knowledge is so critical. So the question for us is, if we would like to, we see the next natural transition in this centre to be a nurse going into an adult service. And in that case, it's where do we locate that nurse? And is it partly, and there's a couple of quite well-developed adult clinics around the country. One's in Sydney at the RPAH and one's at the PA here in Brisbane. I don't think there is an adult clinic for PWS in Melbourne anymore since Joe Proieto retired. He used to run one at the Austin. And then I think the other thing with a nurse in the adult space is really being able to, thanks Tina, the one at the Austin. I think it's closed post-COVID and with Joe's retirement. Okay, Monash and Clayton. So Tina, if you have some people there at the Monash that you think we should be talking with. And then I think the other question about a nurse and in the adult arena is the focus on mental health. And again, here, Honey and Owen, we'd love to be, guided by you as to, whether we really need to be finding someone who's got more of a mental health bent.
Yeah. I think one of the challenges moving forward, particularly in the adult sphere, and we don't really want to make these positions super tied to one particular clinic. We want them to be able to navigate through multiple systems. And so it may be more of a case, and Kathlene and I haven't discussed this, so I may be speaking out of turn, but I kind of think that there is a lot of, as Charlotte so eloquently said, a lot of connection you need to be doing. So just sitting in one particular clinic, while we do that, it's about connecting all the other dots and being really open and, walking alongside the families with your knowledge of the health system to get them to the right places when they need it. And so to me, that's the biggest challenge moving forward. And it's the same with adults, is really about, even if there's not a clinic, that doesn't matter. You can still have a nurse that might be state-based or something, that where they know who's who in the zoo to help you get to the right places. So we do a lot of clinics because we find that it's just easier to concentrate people in one place with a particular sort of disorder. So they build expertise, because quite frankly, doctors and clinicians and everyone can read the book, but you've got to see a few kids to be able to know where you're headed. And likewise for the nurses, you will become experts in this space, but it takes seeing a few to get the real feel. And I think that's where that is so important. I mean, Annie, I would regard as expert as any doctor in the country on 22q, because she's been hanging around them for a long time now. And so I think building that skill set over time amongst a bunch of nurses will be really powerful in driving this clinical care forward.
What sort of, and this question's open to anybody on the panel, what sort of issues should families reach out to you for, or ask their GPs to reach out to you for? You know, we've talked about new diagnosis, but in what other circumstances? Who'd like to go first?
Yeah, okay, I'll go first if you don't mind. Sometimes we get, you know, let's look at acute situation, and you know, a child with Prader-Willi syndrome or individual with Prader-Willi syndrome presents with a mild-looking tummy ache, and then goes and see a GP, and GP thinks, you know, this is just a constipation, for example, and often they might get they might understand, oh, this is a little bit more complicated, and they might give us a call, and then we can help them in acute situation. Another example would be a child with Prader-Willi syndrome going for tonsillectomy, adenotonsillectomy, and then the anaesthetist is aware that, oh, there might be a breathing problem, and should we send the patient to ICU after surgery? And so that's in an acute situation, and sometimes in needing mental health assistance, and sometimes there's a difficulty in transitioning to adult services, and so that's sort of a situation we can help out with.
Yeah, I agree completely with Owen, and they're really good examples of clinical reasons, and to support clinicians that are exceptional at what they do but may not have had much experience with PWS. On my side, a bit of what I've seen, or some of the examples that I've been approached questions with from families are often behavioural issues, issues at school or with school. I've found, unfortunately, a couple of instances where schools don't seem to be as supportive as might be appropriate. So that's been a really important and complex area that I've been able to help with by drawing on the expertise of our developmental paediatricians, our clinical psychologists, our social workers. So that's been a really important area of help. So a bit of that behavioural, psychosocial. Access in regard to appointments, but also in regard to specialists. I've had a number of families ask, for instance, for a dietitian that actually knows PWS, because that's a really important example. I've had families that have sort of said we've gone to a dietitian and it's just not the right fit. And a wonderful example of that, actually, in our PWS developmental clinic, we do have a dietitian who has some really great PWS expertise. And so I was able to link them up with a local dietitian to provide some education, because for some rural and remote families, the only dietitian in town may be the only option. So it's also about kind of providing that education and uplifting more clinicians to be more informed, as Kathlene's mentioned, and obviously as is a significant objective of the centre. I'm sure I have a million more examples, but those are the few that have come to mind.
I think it's really important that if people think there's something urgent going on clinically, they get to a health service. So don't hang around waiting for the nurses to ring you back. Get to the emergency department and then call the nurses from there if it's during hours, rather than actually holding back, because I think if it's an urgent health issue, you still need to follow what you would normally do in going to an emergency, to address that. But if it is something that isn't urgent in terms of can wait till the nurses can get back to you, then that is, I see it in lots of domains, is the connecting to the right people with the expertise, or getting the right people to talk to your people, sort of thing, so that they can support your local people in doing the right things. Being aware of the special things that Prader-Willi kids do in health crises that other children don't, and alerting emergency departments that actually a Prader-Willi kid does it this way as opposed to that way. And that can be a really helpful thing if you're in an emergency department and you feel like people aren't listening. That can be a really good role for the nurses as well, I think. And then it's about navigating the psychosocial stuff, which is probably sometimes even the harder bit, is getting people to listen in terms of what is needed from early intervention perspectives, from school perspectives, connecting you with a social worker, or even telling you what you're entitled to in terms of financial supports. Those sorts of things are all really important. So you can see they're going to need to be a jack of all trades, but trying to help and walk alongside to support, I think, is absolutely critical.
And honey, when you say, they need to be the jack of all trades, I think that really reflects the incredibly complex multi-system nature of Prader-Willi, but it also reflects the fact that there are so few treatments, and therefore the whole environmental structure and discipline that surrounds that child every day is absolutely critical in maintaining their well-being. And I think that's a very difficult, I think that's where people really struggle at school, because every aspect of someone with Prader-Willi is affected by the school environment, and it's very hard to explain that and communicate that clearly. We've had a few.
Tina, actually, particularly when entering childhood. So I think the navigation of what we in child development call transitions, which is your transition into school, your transition to high school, and your transition from high school to adulthood, are often the most trickiest times to navigate the world. And transition to adulthood is even more complicated because you're transitioning from pediatric care to adult care. So not only schools, etc. Hence our, gold star vision in the future is a lifespan service. So you don't need to be transitioning from health at the same time. So fingers crossed, we will get there.
It's just about time for us to wrap up. Before we do, I just wanted to ask whether there's any more questions. I see Tina's typing something. Thank you. Are there any more questions? All right. In that case, I am going to say thank you very, very much. Oh. I think we're just going through to a thank you slide. So we're just going to say thank you very much to everybody that's come along tonight, particularly to our panellists. Charlotte and Anne, we're so delighted to have you on Team Prader-Willi, and Dr. Newton, Dr. Häusler, thank you both so much for everything you do to help us really grow the expertise and grow for Prader-Willi syndrome in Australia and grow the Centre of Expertise. With that, I will say good night, and hope to see you again soon.
Thank you.
Thank you.
Thank you.